Welcome, everybody. My name is Alicia Carmichael. I'm here with my colleagues from the Mobility Finance Network and LAMP to welcome you to our webinar with Justin Bakule from Social Finance. And I just wanted to say thank you for being here and tell you briefly what the Mobility Finance Network is for those of you who are new. We promote financial solutions in support of a global mobility industry for good, benefiting people on the move, whether they are workers, students, refugees, anyone who needs support through finance worldwide. Labor Mobility Partnerships was born in LAMP in 2024, and we now have an informal membership of about 300 people. And when I say we, that includes you. So anyone on this call is officially now a member of the Mobility Finance Network. So thank you for joining up with us and being interested in our content. And we can move on. So Mobility Finance Network is a group of people who are interested in the intersection of finance for impact, cross-border mobility, and human rights and livelihoods. We see that there is a missing space in the middle of these three areas where there's a lot of room for financial innovation and impact that can be had. And so Prerna Chowdhury and I are here as the network facilitators. She and I represent mobility interests at global events. We connect practitioners and funders, and we convene groups to talk through topical challenges and share ideas across contexts. As part of this, we are running a webinar series which will help bring some of these ideas to light and share ideas and cross-pollination across the different people who work in this space. So moving on, we are looking at strengthening the mobility ecosystem through three approaches. One is working through migrant finance, which we'll be talking about today. Another is supporting businesses who need financial solutions to grow and support a just and economically viable mobility industry worldwide. And then investment in tech platforms that can help scale and provide better quality and transparency to mobility systems across the world. And then moving on, I just wanted to click a little bit more on this, why migrant financing. I think this space, it can be a little bit sensitive in terms of what is appropriate for migrants to cover themselves and what is not as appropriate. And so one of the things we focus on here is looking at where costs are not fully covered by employers, where there are bigger price tags required for training, and where we want to give empowerment and agency to the people who want to move and maybe don't have opportunity to access the philanthropy or government support, and thus would be stuck without being able to move without some kind of a financial product to serve them. And so that's why we're working on financing directly for migrants. But in the future, we will cover in Q1 and Q2 of next year, we'll be covering other financial products for businesses and tech startups, et cetera. And so just a word about how to engage in this webinar. You can use the chat function. We encourage you to introduce yourselves, just say who you are, where you're from. We have all of the kind of videos turned off just for simplicity, but we do want to know who's here and make sure that you connect with each other as well as with us. And then if you have a question for our presenter, you can submit that through the Q&A function, and we'll be organizing those questions and making sure that we don't duplicate along the way. Feel free to submit at any time. We'll address most of the questions at the end, but there are parts of this where if there's a specific question that relates to content, we'll address it in real time. And so moving on to the part you're really here for, I wanted to welcome Justin. He is a member of our Mobility Finance Advisory Council. We are very lucky for that because he's done a lot of really good work in this space, just a little bit removed because he works more in domestic work, but so much of his work can be taken as lessons learned and guidance for working across borders. Justin is Vice President of Impact Investments at Social Finance, where he works with educational institutions, employers, and capital providers to build economic mobility opportunities for underserved populations, primarily for healthcare workers. Justin has held leadership positions at Ceres, FSG, PwC, and he's the founder of the Shared Value Initiative, where he was the first executive director. And he also served in the United States Peace Corps in Mali. So can certainly relate to a lot of the people and their international experience on this call today. Social Finance is a nonprofit and registered investment advisor. They work across public, private, and social sectors to build innovative partnerships and investments that measurably improve lives. So thank you so much, Justin. We are really thrilled to have you here. We will hand it over to you to walk us through your the loan product that we think is really relevant for this space, especially for healthcare workers trying to move across borders.
Excellent. Thanks, Alicia. It's a pleasure to be here. And if anything, thanks for the introduction. The last 4 years that I've been at social finance are really the first 4 years where I've been domestically focused. So, and most of my work before this at FSG, and of course, when I was in the Peace Corps, was internationally focused. And so, great common cause, I think, with the people attending here who are part of the network and so forth. So thanks for being here. And honestly, what we want to walk through today in this loan fund that I oversee, two loan funds, but we'll talk about one that are domestically focused in the nursing industry. Really what we're here to talk about is a model and an approach. And really what I hope to accomplish is that you just can see the design elements that are at play within a loan fund like this and be able to apply them potentially in different ways to your own situation. So why don't we just go to the first slide? What I'm going to do here is walk quickly through the model in general, and then I'm going to pull apart the component parts of the model because really at our heart, social finance, and I'll use this word again later, we're really an intermediary, and we're intermediating between a set of different stakeholders in the name of social impact and social progress for the students we're trying to serve in a way that may not happen without our active work and active bridging. I'm very much a visual thinker, and the work I think about in Renew is really about for the students we're trying to serve. It's really about building two bridges. The imagery I have in mind are bridges. Bridge number one is to take historically underserved learners and get them into a good school to pursue a degree of high value. And bridge two is to take them from that school and from that educational experience and get them into employment that generates economic mobility, discernible, measurable economic mobility for them. The tool we have to work with to create those two bridges is money, frankly. It's utilizing money in creative ways to build those bridges for students. Now, in a pay it forward fund structure, as you see here, we really, I'll walk through the 5 steps. We look for, and I'll talk extensively about how we think about different forms of capital, but aligning capital and its purpose as a source of initial funding to put students, number two, into high quality. I'll come back to all these points, high quality training providers that are in jobs that are aligned with market demand. And then we get those students placed into meaningful employment. We'll talk all about the employers, what we look for employers, what their situation is. And the employers, then, what we're hopefully doing is both fulfilling a business need that they have for talent, and at the same time, in some cases, also meeting a social impact objective that they may have at the same time with the people we're placing. And then importantly, within the structure, and what would distinguish it, say, for instance, from just a scholarship where we're using scholarship money to pay for somebody to go to school and get a job, is we're financing it because we're recapturing those payments in an effort simply to serve more learners, right? So as a nonprofit, what we want to do is get the greatest amount of leverage we can out of that money to serve more learners and create more opportunities, more growth, more job opportunities for the people we're serving. So let's go to the next slide and we'll talk about how that manifests itself within Renew program. Can we, sorry, go to the next slide? Thank you. Okay, so within Renew, let's start with what Renew stands for first. Reinvesting in nursing education and workforce. Huge need in the United States, a shortage to the tune of about 30,000 nurses per year across the country. So we set up the Renew Fund, and again, I'll talk through all the dimensions of how the fund is organized, who it serves, what it does, and how. But the basic mechanics are that eligible WGU, Western Governors University students, apply for a Renew loan. So it would be just like financial aid. They get an option if they're eligible. I'll tell you, explain what eligibility looks like, who the students are, the dimensions of all of that in a moment. But they apply for a Renew loan like they would any other loan that funds their school, which means tuition and total cost of attendance, which in this case includes traveling to a lab, a simulation lab, the expenses associated with clinical rotations and fees and everything. So total cost of attendance, and I'll go through the dimensions of what that loan looks like in a minute. They use that loan to fund, in this case, we've designed it, their final 2 years of a 4-year degree. And again, I can explain the dimensions there of risk management from our standpoint of why it funds, and based on the type of education it is, why it funds 2 years. Students graduate, they pass the national certifying exam to become a nurse, and they become working as a registered nurse. Ideally, then they have one of two choices. One is just to go work wherever they want and they pay us back the loan. Again, I'll explain those dimensions in a minute. Or two, they go work for a partner employer, and we're building out an employer partner network, because in the cases where we place them with a partner network member, that employer is agreeing to repay their educational loans on their behalf as a mechanism of attraction and retention of that worker to their health system. And then all repayments, whether they are from the learner or from the employer, again, are put right back into the fund to then be recycled and serve the next generation of WGU students. Now, within this structure, relatively simple, at the end of the day, we're making a loan, we're getting a person through school, remember my two bridges, and we're placing them with an employer. And then ideally, the best case for us is that employer is repaying the loan and we're doing it all over again. But there's really four sets of stakeholders here. And this is where I think for people who are listening, honestly, you can think about each one of these as having design components. There's the students and who we're trying to serve. There's the school and how we think about what kinds of schools to pick and partner with and for what reasons. There's the employers who we would like to make that hire and repay the loan and how we think about targeting them and what their motivations are. And then there's the capital providers who are the folks who are underwriting this entire thing, mission oriented. Again, I'll talk about who they are in a minute. And those capital providers and their motivations, and matching the return expectations of this whole cycle. In other words, how much money are we going to get back from this with the expectation of the money that's been provided to run the fund. And then there's us as the intermediary that, as I said, pulls that all together. So why don't we talk about, and we can pull down the slides if you want. I want to walk through each of these four components in some detail. And if folks have questions along the way, feel free to put them in. I'm happy to pause on each one of these components. Or alternatively, I'm also happy to just take questions at the end. So let's start with the students. Most importantly, as a nonprofit, we start and end with who we're trying to serve. And in all of our funds, in ReNEW and the many other funds that we run, we're typically looking for historically underserved or marginalized learners in the United States. In particular, of course, for this kind of approach to work, where a financial barrier is what's getting in the way of this person being able to access and persist through an education to get a better job. So both being able to start an educational journey and complete it. It's so common that financial barriers are what get in the way of that cycle working. So we're typically in different ways trying to serve underserved and historically marginalized learners. In the case of ReNEW, specifically, how do we do that? We look for Pell eligible learners with Pell eligibility as a marker of financial need. Now, when you think about the product and you think about the students we're trying to serve who have challenges with access to financing, access to borrowing, we want to make this financial product, because ultimately they are taking out a loan, as student friendly as possible. What would constitute being student friendly? Well, in the simplest terms, if you were going to borrow money, charging a 0% interest rate. So no interest repayment when you're repaying that loan. So a zero interest rate loan with zero origination fees. So we're just, in essence, in a student lending context, saying we're just going to offer you a very low priced product. In addition to that, however, we also make our loans what's called outcomes based. So if you think about it from the student's perspective, when you go borrow money to go to school, you're taking on a risk. You're taking on a risk that not only are you going to get through that education and graduate, but you're taking on a risk that you're going to borrow money, and that at the end of that, you're going to get a job that is going to justify the money that you borrowed and enable you to repay that financing, as well as have hopefully a productive income and living situation. So we make our loans what are called outcomes-based loans. And what that means is if a student doesn't graduate, in the case of nursing, if a student does not pass the national certifying exam, and if the student does not get a job as a nurse making at least $60,000 a year, they do not have to repay us. So the student is getting downside risk protection. If the cycle doesn't work, I don't have to repay. Obviously, in the United States, huge problem with trillions of dollars of student loan debt outstanding. And we're trying to make sure, even in situations where this doesn't work out for the student, we're not leaving them worse off. Then finally, student friendliness also extends, and I'll talk more about this in a minute, to the employer repayment option. And hopefully thinking about when we get to repayment, who's best to repay? I would rather someone repay on behalf of that student, where we've created business value for that employer, than the student having to pay at all. So that to us constitutes student friendliness, and there's many other dimensions we might think about. Now, let's pause for a minute and think about, I'll jump to the fourth category just for a minute, because with each one of these, there's challenges. And the challenge in offering a really student-friendly loan product like this is, you can imagine from a financial capital provider standpoint, if I'm covering every person that doesn't graduate, doesn't pass the exam, doesn't get a good job, though in nursing the placement rates are very high, and I'm offering them zero interest with zero fees, I can be quite sure without a lot of modeling expertise that I'm going to lose money, right? So let's just hold that thought. That pool of money, if I'm given $100, I'm going to lose money on that. Now, of course, from a design perspective, we're thinking about every way that we can reduce that risk of losing money, but we do want to start and orient around a really student-friendly product. So let's take us then to piece two, which is one way to reduce that risk is to think about the school. And in this case, we're working with Western Governors University. What do we look for in a school when we're going to place this bet that we're going to finance students to get through the education? Simply put, we look for two things: quality of the institution and scalability. Obviously, we want to design these in a way that can serve a lot of students, but most importantly, again, to reduce our risk of these loans, we want schools that can provably get students through school, graduate them, and place them in jobs. So in the case of WGU, it's one of the largest nursing schools, if not maybe, depending on the source, the largest nursing school in the US. The pre-licensure program that we're financing here is already offered in 24 states, expanding to 36. So you've got a school already that's large. And in terms of quality, one thing I like in the United States about healthcare occupations is that most of them require a certifying exam at the end. And that's a really nice, easy third-party validator of quality. In WGU's case, about 92% of students pass that NCLEX exam, which is either at or just above the national average for nursing schools as an indicator of the quality of their graduates. In the case of WGU, as an educational delivery model, it is not a traditional nursing school. It's a hybrid model in which the first 2 years can be done primarily online. And the years 3 and 4, which are the ones we finance, are much more approximate a traditional nursing degree in that it's online, but also clinical rotations and labs are all in person, because obviously can't become a nurse without having in-person time. And then fourth, and I wouldn't want to jump over this one, even though I put it fourth on the list, is a mission alignment with what we're trying to accomplish. In this case, WGU is a nonprofit university, mission-oriented, who already serves and would like to serve more Pell-eligible high-need learners. So that aligns with what we're trying to accomplish as a mission-oriented organization. Again, to pause, sounds great, but the challenges, there are several when thinking about schools. Number one, and we've sort of gotten past it with WGU, but most schools that we want to work with don't grow. If you think about it, schools are not set up in the same way as adding Amazon warehouses or other things. They don't grow and scale in the same way. So we have many occupations, high demand from employers, high interest from students, would create economic mobility, but perhaps they run through a community college system in the United States that's really hard to scale. So if that community college is already at capacity, they have wait lists for students, it's very hard for innovative financing to now trigger and provide greater numbers of opportunity. So schools have trouble growing. Number two, many schools that we work with, they really do not track their outcomes. So they can't tell you if one important outcome to us is what percentage of students get jobs at what kind of income levels. The schools don't know. So if you're trying to ascertain quality in placement and achievement, they don't really can't provide you that information. Again, that just limits your visibility in how well the cycle of learning in a student-friendly way and getting paid back is going to be. It increases the risk. Let's turn to piece three, the employers. So what kind of employers are we looking for in this situation? I think if I pull back contextually for a moment, in general, we're looking for occupations where the before and after shows substantial income growth, right? So one thing that we think about is just, are we going to put the person off in a much better situation after the education? Nursing, the students we have at WGU, we estimate pre-program income at about $36,000, post-program income at about 80. So we're looking at potentially doubling the income of someone before and after. So that for us is very strong. Number two, honestly, we're looking for employers, and it's hospitals mostly, who have massive talent problems, like have big problems. Another thing I always have found in engaging over the last few years with all these hospitals is that a lot of people in HR will tell you about a lot of problems. Everybody's got problems that they're willing to tell you about, but it's a shorter number of problems that you're willing to pay for and invest in. And really what you're looking for are problems that an employer is willing to pay for and invest in. So in a hospital context, what that may mean in the US is they use a lot of temporary staff who they have to pay a much higher rate. Now, all of a sudden, someone here that they're hiring, but they're repaying overtime to retain them is a better business deal for them. So we think very much and talk very much about what's the business impact of their ability to hire this person and the value it creates. The repayment structure that we ask the employers to make is structured over 3 years, where if the student leaves, the employee leaves during that period, the outstanding 0% student debt would convey back to the student. So this provides a risk protection to the employer that they're agreeing to repay to retain somebody over that time frame. And if it doesn't work out, it goes back to the employee. So that's a really nice way to control the risk from the employer standpoint. And so we think about and talk to employers from a business side. When you hire a new nurse, typically how long does that nurse stay with you? Oh, a year. Okay, for this financial commitment, we are giving them an incentive to stay with you for 3. Is that an improvement? Does that improve your business metrics? Yes, absolutely. Secondarily, with employers, typically we are finding that they are far from people who are saying, wow, I just have all these openings. They're really typically very sophisticated, have a long list of educational partnerships where they're sourcing talent already. Yet the problem is still larger than what they can handle with all the things they're doing. So they look at this as a new way to try to close the gap. And then third, we're often looking for a mission alignment with the hospital. So many public hospitals see themselves as anchor institutions in the community in which our students would match their patient populations. And they think about that very much from a health equity standpoint. Ultimately, at the end of the day, 2 challenges that we run into with employers. One, fundamentally, you're asking them to pay for something to solve a problem, which they would rather maybe just that they didn't have to pay for. So that's always a little bit of an uphill battle. And then secondarily, many of the hospitals in the US, and increasingly so, are consolidating. And so they're large organizations. And so the business development process gets tangled up in a lot of organizational complexity that relative to their scale. Let me turn quickly then to bringing it home to the fourth piece, which is the capital providers. Who provides the money? What kind of funders do we look for? If you think about this cycle, again, making a student-friendly loan, paying to get them through school, trying to place them with an employer. We have a lot of things that we're talking to a potential funder about within that. And many of those dimensions, certainly at the outset, are contributing to an expected financial return, which we can project, but which is highly variable. The biggest variable for a number of reasons being what percentage of those students are employers repaying versus repaying themselves, and big variability in the potential outcomes. So at the outset of the ReNEW Fund, we're raising money from philanthropy, from foundations, and the money we're raising is grant money. Though across our funds, we raise grant money, we raise recoverable grant money, and sometimes we also raise impact investments with where the funder is expecting the money to be returned with a positive interest rate of some sort attached to it. In this case, given the high level of uncertainty, we started by raising money with philanthropy. And the promise to philanthropists is that compared to a grant, we're going to recycle that money and get effective use of that philanthropic dollar in this recycling mechanism. The other key place we're often raising money, and the other healthcare fund that I oversee, is from a state. And typically that state is highly focused again on the recyclability, where their normal mental model is we have workforce dollars that we invest. We generally don't have a good idea of how effective they are in terms of actually placing people, the outcomes. So we see this model as one, getting us closer to understanding the outcomes, and two, even if we get some of that money recycled, 30 cents, 50 cents on the dollar, that still lets us reuse those important budgetary dollars a couple of times more than we would when we just pay it out and write a check. Now, the challenge is here, and I'll wrap it up with this. The fundraising process and the matching process and the cultivation process to raise money at scale, it just takes a long time. And a structure like this is complicated enough that it requires a lot of explanation. Here to give folks a sense of scale, we're in the process of raising $100 million to support this fund, which would support about 7,000 nursing students over a 20-year time frame based on all of the recycling. It's a relatively high per person cost for us in our portfolio, which is why $100 million, supports 7,000 people. And so we're often, I think, with our partners, both depending on their level of experience and sophistication, we're explaining the model first and kind of re-explaining the model and placing it for them. And in an American foundation context, they may have somebody who's the grant writer, somebody in impact investments. We're trying to figure out the right person to get the message. They hand it to the other person and so forth. So it's just a pretty ongoing and laborious process. But we've raised for this fund about $22 million on a $100 million target. We've, to this point, financed 400 students who are currently in this program. We have one employer partner signed on with sort of dozens in various stages of development. And as a final thought, if you want to know for our team sort of how I spend most of my time, it's in two ways: raising money and pitching to employers. So those are the components once we have the whole thing set up and flowing where most of my time is spent. Now, Alicia, I know we have 15 minutes, so I was going to pause there. Those are the four components, and I'm happy to take any questions or dive in where most helpful to folks.
That is great and so helpful and so relevant to what a lot of us in this mobility space across borders are facing. Two things you said about that you spend your time on are one, pitching to employers. So generating demand, and that it doesn't necessarily always translate that demand or need for a worker translates into demand to participate in a program that you have designed, right? And so that process, it's something that we see across so many contexts that we work in and that our partners work in. And I was wondering if you could say a little bit about that process of convincing. So I'll note for those
Yeah.
who don't know the US market that there are many hospitals who are willing to pay 3x the salary of a nurse for a traveling nurse to come fill a hole, but participating in something that takes some advanced planning or paying for an international worker or
Yep.
committing to something that's more structural takes convincing. And so it's like, well, why does it take them convincing to do something that's actually cheaper and more thoughtful when they're spending a lot on this like Band-Aid solution of a visiting nurse? So if you can talk about that converting need to demand, that would be really helpful.
Yeah, absolutely. I think two things. Generally, when we talk to a hospital, there's a sort of starting binary condition, I would say. And that binary condition is we have what we view as a intractable problem that we can't address in any other way, or we're sort of moving along and it's problematic, but not an intractable problem. And if it's just sort of problematic and annoying, and we have a few travelers coming in, It generally is not, it really goes nowhere from our standpoint. So you're just in the world of people who really have a problem. And what I would say is and I've seen employers really ask, well, let me put it this way. We tried kind of almost every version of trying to get employers to co-invest with us, provide money before we delivered the talent. To be clear and renew, and I probably didn't mention all these dimensions, but we've basically had to de-risk it down to the employer as far as we possibly could, meaning an employer does not pay us $1 until the person is delivered to them. So what we realized is like the only time an employer will pay is when the employee is creating value, which means they're an employee, not anything else. So they don't start paying till they are employed. They stop paying the day that they leave, either at the employer's decision or the individual's decision. And and in addition to that, there are no requirements. There are no, you don't have to meet a certain target. You're not pre-agreeing to hire 10 people. It's basically scalable to whatever that need is to you as an employer. Um, and it felt like to us that otherwise it was kind of a non-starter with anything that went outside of those bounds. So I think being really practical about that. I would also say that I think we've been generally more successful with in conversations where the mission and the business impacts matter. And for somebody with my background who has worked at that intersection of where business and social interests meet, um, I would say I generally pitch the hospitals based on the business impact first, but we found that where people value WGU, value what social finance is trying to do, value matching the employee base with their patient base, they want to make sure that the business case works, but they ascribe some value to the social case as well. And I think with the pure for-profit systems, it's much more purely like just the dollars and cents and like, can we plug a hole with this? And what are we doing? I would say then the business case that we've made to folks is based on two dimensions generally. If they see this as a replacement for a traveler nurse, the numbers are really easy to make because it's so much cheaper than what they pay someone to come in. If they see it as a mechanism of retaining a nurse longer, we're paying a little more for the retention benefit. Then basically with a few hospitals where we've analyzed it, we need to double that new nurse retention, like 9 months to 18 months for it to pay off for them. And of course, then they always say, well, okay, have you done that? And we don't have enough results yet to know. So at the outset, they're still a little bit taking a bet on that financially.
Great. That's so interesting. And yeah, so many parallels to the cross-border context. We have a couple questions coming in. So
Great.
I'm actually going to combine one question coming in with a question that I had. The question that came in is understanding the ROI that you present to donors. And so
Mm,
social ROI, how do you think about and quantify the impact per every dollar they spend? And I would
yeah.
say if we can combine that with the question of how you convinced these first philanthropies to go from a pure donation kind of scholarship model into this recycled fund model, how long that took, and how you used this impact data as part of that process.
Yeah. And so I want to start by saying that I think there's one answer to this question, which we do for sure, which is just the purely financial calculations of what do we expect the fund to return? What are all the dollars and cents? How much money is going to recycle? Ideally, it would be $1 in and $1 out, $1 out and $1 in, and it would be a truly evergreen fund. And then you could say to a philanthropist, like, every dollar you give us is going to recycle into perpetuity. For us, the biggest dimension right now that would drive that, and I'm happy to explain it if you want me to, is the percentage of students who end up with an employer partner repaying versus repaying themselves. And it's for a couple of reasons. One, because that employer is going to pay us back more quickly, so it's a shorter duration. And importantly, what we've seen in our student financing portfolio is the compliance of us being repaid by an institution is basically 100%. And suffice to say, the compliance of us, even at 0% being paid back by an individual, is way less than 100%. So the financial implications just of that sole dimension, which we can't really answer, means we typically have to show any potential funder a pretty broad range of like what this whole thing could look like. Which is also, by the way, when we've had conversations where the person says, well, what about a recoverable grant? Or what about an impact investment? For the moment, we have to say, you know what? Let us get some results that give us confidence around being able to deliver to that financial standard. And then we'd be happy to discuss it. But right now, given the uncertainty, we can't do that. Now, that's one way that you can, and we certainly do have that set of answers. The other way, though, is purely relational. And I think anyone who's out there pursuing these kinds of fundraising efforts knows this. But like our first large funder, the DeLuca Foundation, Liz DeLuca, who that it's named after her husband, but Liz was a nurse. Liz believes in the power of nursing to create economic mobility. Their executive director had invested in a social finance fund when he was at the Michael and Susan Dell Foundation. And when he came to become the executive director of the Fred DeLuca Foundation, he wanted to expand them from scholarships to a broader purview of financing. So we could have done all the dollars and cents, but you also needed those relational elements, I think. And to be clear, of course, the DeLuca Foundation asked us all these hard questions, the technical financial questions, but honestly, you needed the right moment in time and the right relationships too to get them in as the first major supporter. The other thing I want to mention here, because it's um, you know, fun to reflect on, is actually the first supporter of the fund was WGU themselves. And they decided to put in the first commitment to this, knowing that we needed to just get started and get launched and to be able to tell people we were supporting people. So they actually put in the first financial commitment.
Great, thank you. Definitely addresses our question about how to we see a lot of like how do we go from starting to actually scaling, and then these proof points along the way, which proof points are necessary, and there's the long relationship build that it takes. You can't just like drop into a fund that already exists or a philanthropy that is already doing what you're doing. It's likely that you have to kind of co-create and build. So thank you for that. We have a few questions here about risk mitigation, which I think you've mostly answered. So I'm going to this question from Amol. I'm really curious about, and his question is about when you scale this outside of the USA. So maybe we'll broaden
Mm,
that and just ask if you were thinking about this from a cross-border perspective, and you have a person getting educated or getting training in one country and then getting a job in another country. Are there things that you would consider in the scale up of this that are unique to a cross-border situation that you would want to have on your radar in the design process?
Yeah, I mean, I think it would be predictable to this group, but all of I mean, clearly there's a whole level that I haven't worked on that to me, that would be the technical level of work authorizations and transferability. I think I saw that Ed Shapiro was on here a few years ago. Ed and I worked together on some work he was doing with Ukrainians. Obviously, at that time, we had to think about, the transferability of educational credentials, especially in healthcare, how challenging that was, who was going to take on that responsibility to make sure that transferred or would be given credit for. So I would think about those kinds of issues, as well as, I think also there's, in particular, I would say on the employer side with relationship development, um, I'm often thinking with the hospitals, like how close does this approximate what they already do and know? And how much is this asking them to do something they've never done before? And clearly, the former category is an easier way to get in and make a pitch than asking them to do something that's outside of what they're accustomed to. And I think just being realistic about that. One thing that we're working on right now is trying to get more closely integrated with loan repayment benefits that employers already have, and trying to ask ourselves the hard questions of like, because they're less than we require financially, and usually the student is co-paying at the same time, but that's still net going to be better for us. So how do we make that an easier integration to benefit from it while not replacing our traditional partnerships. So I think just being open to like, what are the dimensions you have to solve for that would be unique to a cross-border situation? And and again, I think if placement ultimately is often the key to a lot of this, like what's your almost starting with the placement side and validating that piece before, really getting the rest of it underway would be how I would think about it.
Great, thank you. We have a very tactical question, just the range of the loan and the USD value. So what is the quantum that the nurses are
Yeah,
taking out?
for $40,000, $20,000 per year for 2 years. I mentioned it was in years 3 and 4. Let me come back to that point. It serves two purposes. In WGU's educational model, those first 2 years are online. Um, our key counterpart there always describes their student body as adult, some college, no degree, pre-existing debt. The online model for the first 2 years means that we know from their data that their adult learners can keep working while they are in school, and their education is competency based, so people can speed up if they need to try to get through that, as well as generous transfer credits. We also know that persistence, e.g., getting the degree once somebody gets to year 3 is really, really high. So once they get to year 4, because of the clinical rotations, it's much harder to work, which means the financial barriers creep in and an inability of people to get through because of financial reasons. So we wanted to support that. And then because persistence is high through years 3 and 4, it reduces the risk of people not graduating once they've gotten to year 3. So, but those 2 years, $20,000 each year potential. And the last thing I should say that we've learned from many different fund experiences, that number is reflective of a total cost of attendance, not just tuition, because frankly, oftentimes the financial barrier here is around living expenses. We run an emergency fund that can fill the gaps for people on a case by case basis. Um, because honestly, it's that part of it that often gets in the way of persistence more than it is just covering the tuition.
Great. Great. Well, we have maybe one more question coming in.
Yeah.
We'll with that one. So question I'm just reading it now. Um, have you thought about areas where this kind of financial product could move not across borders, but across sectors? So have you seen other areas of great need where if you could replicate this, you would embed it into another sector?
Yeah, absolutely. I mean, I think the extension possibilities in healthcare, first of all. So same industry, but there's a wide variety of roles in which this could apply. As I mentioned during this sort of part when I was talking about WGU, the limiting factor there is usually the schools. So radiology technologists, respiratory technologists, um, we run a fund in conjunction with San Diego around mental health professionals. So there's a lot within healthcare where the supply demand imbalance is really large. Other ones that are outside of that, we run a fund in Massachusetts for a climate career fund, it's called. So for climate careers, HVAC, elements like that. Truck driving in the United States is another one. Mostly looking for that before and after of pre-program to post-program income and just making sure that there's both demand for those jobs and the post-program income. And then, of course, for many of those, it implies a much different level of financing needed. Most of those allied health professionals are 1 to 2 years in school, not 4 years in school. And some of them are even shorter, like if you're getting a CDL license or things like that. So, starting with demand, understanding the before and after. I would say one of the most common questions we get, especially in healthcare in entry level roles, just to name this, is that oftentimes the entry level role, like being a patient care technician, a certified nursing assistant, if you need money to help get someone through school, the job doesn't pay enough that should be financed. I mean, really, frankly, the answer is you either need a scholarship or the employer just has to pay for it. And many of them do, but we will frequently get questions about could we finance, an emergency medical technician, and they just don't make enough money that you would want to put that debt on a person to try to have to repay if you didn't have to.
That's great. And I think there's a lot more we can learn about how you make that measurement. At what level does it make sense to provide that? We are at time though, and I want to respect everybody's movement to the next appointment on their calendars. So thank you so much. this is entirely relevant. We keep hearing things that people have asked us about or brought to the community. So it's really nice to have some real world experience. And I know you're still learning and still collecting proof points. So we'll be curious to keep following your news as you go. Is there a place where we can learn more about the ReNEW Fund as it grows and has more data points behind it?
Yeah, absolutely. Two things. One, the one of our funders actually has already funded us for extensive monitoring and evaluation work to really measure outcomes on it. So that's probably still 2 years out, given that we're just having our first grads now. But that's one thing. And then obviously WGU Renew. I don't remember the exact website, but if you just look up Renew Fund, you can find it. And what I would also say, Alicia, is like as people have listened to all this, just greatly appreciative of the opportunity, but also humbled that the network is doing great work. And if this either turns on questions for folks that they want to ask me in a follow-up, I'm happy to do that. But also if people have experiences in their work that they think we would benefit from, I'd love to learn about that as well.
Well, wonderful. That's a great closing. I'll say that leads right into our poll. So Haley, you can launch our poll. We want to know from everybody who's participating what you'd like us to cover in the future and any feedback you have on today's webinar. And if you wanted to get in touch with Justin directly, feel free to drop that into the poll as well, and we'll make sure that you're able to follow up. Thank you so much, Justin. Really so great to have you here. And I will hand it over to Prerna so she can tell everybody what's coming up next in our webinar series. And Haley, you can skip to the next slide. Great.
Thanks again. Thanks so much, Justin. So practical and useful. Up next, so we have two more before the end of the year. Early December, we have Ashley Sherwin talking about how to establish credit history through peer lending, through a platform that she's currently building, and very, again, relevant to migrant workers, particularly more low to mid-scale trade and service sector workers. And then we'll kick off next year. Sorry, actually, Ashley Sherwin is our last session for this year. And then we'll kick off next year in January, exploring cost and risk sharing models with a German organization, Bauerbande, and we'll be looking at how we'll be sharing cost and risk across employers, workers, and other stakeholders. So similar to a similar model, a solution to today, but in a very different context. So thanks again. Thanks so much for joining all of us, and we look forward to having you join us next month, and we'll be sending out the registration details very soon. Thanks again, Justin, and over to you, Alicia, if you want to wrap up.
Thanks, everybody. We're just happy to have you here. I've posted our LinkedIn group in the chat, and you are welcome to reach out in any way to let us know how we can be helpful to continue the conversation together.